Hi, everyone. We are good to go. So we would like to start this webinar. It's an information webinar about 2019-2020 Sprout Grant. Joining you is yours truly, Alyssa Hursky. I'm the Funding Programs Officer from SSHRF, and I'm joined here by Kate Dunn, who's a Knowledge Translation Specialist from SCPOR. Kate, you can say hi.
Hi, everyone.
So we have some slides for you that will outline information about this grant, and then at the end we'll open the floor for questions and answers. So we'll start off with our agenda. We'll talk about the funders and about the program itself. We'll quickly go through what's new this year, some of the important dates, and then dive into the actual grant funding, eligibility, the process of application, the review process and criteria, and then, like I said, we'll have some hopefully helpful tips and then questions and answers. So for those that don't know yet, SSHRF is a provincial funding agency that invests in research that contributes to improvement of health of Saskatchewan people through a high-performing health system with a robust culture of health research and innovation. We accomplish this through our strategic goals, which are to strengthen research capacity and competitiveness, increase investment in research and innovation, as well as to align research with stakeholders' needs. And then now Kate will tell us about SCPOR, because they are the other funding partner.
Thanks, Alessia. Hi, everyone. Kate Dunn here, Knowledge Translation Specialist at the Saskatchewan Centre for Patient-Oriented Research, otherwise known as SCPOR. Our mandate is to support patient-oriented research in the province of Saskatchewan. We want to support an environment where patients, families, clinicians, researchers, and policymakers will work together to identify research topics, do the research, and then use the results of that research to improve patient care and the health system. During the Sprout Grant, there are two phases of support that we can offer researchers. First are the supports happening during the application phase, and the second phase of support can be accessed by grant recipients. Our supports are offered through our 5 SCPOR platforms, as you can see on the screen. Some of the supports offered in the application phase include, but are not limited to, patient and family advisor recruitment, Indigenous research and engagement module training, patient-oriented research module training, data services consultation, knowledge translation resources and references, consultations and quotes from research support partners, such as the Clinical Trials Support Unit, Social Science Research Lab, and the Clinical Research Support Unit. Some of the supports offered to Sprout Grant awardees include, but are not limited to, patient and family engagement coaching and facilitation, patient engagement evaluations, OCAP compliance and empowerment coaching, data extraction and linkages, GIS mapping, access or assistance with knowledge translation development plans, methods consultations, and connections with researchers and additional SCPOR supports such as trainees. For a detailed list of the SCPOR supports, please see the Sprout application package or contact myself, Kate. Thank you.
Thank you, Kate. And then the really good description of the supports you can find in Appendix A and B in the application package. So we'll move on now about talking about the actual program. So the purpose of Sprout is to cultivate patient-oriented research in Saskatchewan, as well as to further work of SCPOR to build capacity and collaborations to conduct responsive, equitable, innovative, and patient-oriented research that continues to improve the care and health of Saskatchewan people. This Sprout 2019-2020 is the final call for the patient-oriented Sprout Grant. So I just want to bring attention to that. So the objectives of the program is to fund patient-oriented research projects that will create new knowledge that has the potential to improve patient care and health system in Saskatchewan, to increase collaboration between academic researchers of different disciplines, patients and caregivers, community-based researchers, healthcare practitioners, and health system decision makers in the province, to support emerging research having a sound justification and rationale, which has the potential to improve patient care and health system in Saskatchewan in the foreseeable future, as well as to increase chances for further funding to support next steps including further investigation, scale up, and implementation. Oops, went too far. So what's new this year? We have some of this is we made some changes to what we had last year, and some of it is new. We have incorporated the feedback from last year's grants from 2018-2019 competition and made significant changes, and hopefully have improved the process. So we have SCIP Patient Engagement Application Development Award, which we call PITA Award, which is intended to support patient engagement activities and to prepare a Sprout grant application. It's up to $2,500 per team or project, and Kate will speak more in detail about that. We still have eligibility check. So prior to opening an application, the principal applicant will need to complete the eligibility check on SCHRF's RMS. This step will determine eligibility regarding the principal applicant's eligibility, team requirements, as well as fit within the program. Budget. The proposed budget, as in previous years, must follow both the SCHRF guidelines as well as tri-agency guides, because it's a combined budget between SCPOR and SCHRF. We still have mandatory SCPOR patient-oriented research module training. It's a two-part course intended to help participants acquire foundational knowledge about health research and to allow them to become full-fledged members of research team. Training is mandatory for principal applicants. However, we encourage all of the team members to participate, and training is free. We have Rooted Committee. Basically, successful Sprout grant applicants will be required to meet biannually with representatives from SCHRF and SCPOR to talk about challenges, things that go right, things that go wrong, and what can we do to help you along the way, as well as funding envelopes. So this year, we have up to 7 teams that will be funded through the competitive process, with a minimum of 2 Sprout grants dedicated to teams affiliated with either Saskatchewan Polytechnic, Saskatchewan Health Authority, St. Thomas More College, or Parkland College. Important dates. Competition has launched on June 10th. At the same time, the PITA funding competition has launched as well. Obviously, today we have the information webinar. The deadline to apply for PITA funding is October 15th. However, you are encouraged to apply before the deadline. The earlier, the better. Eligibility check cutoff is October 2nd. The deadline to complete the mandatory training is the same as the application deadline, which is November 26th. Funding decisions will be available February 28th, with the funding start date of March 1st. We do encourage you to check with the host institution for internal deadlines and allow some time to obtain signatures. Keep on skipping slides. So Kate will now talk about PITA funding.
Great. So once again, we are pleased to offer the Patient Engagement Application Development Award, otherwise known as PITA. So this is where teams can request up to $2,500 to be used towards patient engagement expenses. Some of these expenses could include patient honoraria, mileage, accommodations, etc. For a full list of the eligible expenses, please see the application package or the SCPOR website. As Alessia mentioned, the applications are now being accepted and PITA is actually open. The deadline to apply is October 15th, 2019, and the deadline to actually use the funds will be November 26th, 2019. There is a limited funding available, so please apply early, and you can find the PITA application on the SCPOR website. If you have any questions, please reach out to myself, Kate, at SCPOR. Thanks.
We'll try to adjust the difficulty of, some people said that it's hard to hear us, so we'll move the microphone. Hopefully this is better now. You can let us know if you can hear us better. And we'll move on to, let me just check. Perfect. We'll move on to talk about grant funding. So the total value of Sprout is $180,000 with the equal contribution from Sprout and SCPOR of $90,000 for over 2 years. It will have a minimum of 7 teams that are funded, and as I mentioned, 2 Sprout grants are dedicated to teams that are affiliated with either Parkland College or Sask Poly or Saskatchewan Health Authority or St. Thomas More College. The duration of the grant is 2 years and the funding is not renewable. Before we begin, if you ever have any questions or stumbled upon something that you're not sure about as you're filling out the application, we have lots of resources that you can go to look for possible answers. Of course, you can always reach out to me or Kate. But so the first one is the Sprout Grant 2019-2020 Program Guide, which is available on our website. We have the newest version of our awards guide, so 2019, as well as SHRF's RMS has all the information that you need. You can go to SHRF.ca resources, SHRF.ca opportunities, as well as SCPOR.ca Sprout 2019-2020 page. They also have all the resources available there. So eligibility, who's eligible for the grant? The eligibility is based on a team because Sprout is a team grant. You must have a minimum of 5 team members based in Saskatchewan in the following roles: a researcher, a decision maker, healthcare provider, and 2 patient family advisor team members. Each person can only fulfill 1 role. So researcher is defined as an individual with formal training who holds a position which supports them to pursue research and whose expertise supports the proposed research project. They will be required to submit CV demonstrating their relevant academic contribution. Decision maker is an individual who makes decisions about or influences health policies or practices and are likely to be able to make use of the results of the research. Decision makers can be practitioners, educators, healthcare administrators, elected officials, and individuals within the media, health charities, patient user groups, or the private sector. Healthcare provider is the individual who provides preventative, curative, promotional, or rehabilitative healthcare services in a systematic way to people, families, and communities. They may operate within all branches of healthcare and may also be a community health expert working for the common good of the society. The patient family advisor, or PFA, is a term that is all-encompassing and may be replaced with client, family, resident, person with lived experience, community, and community-based organization. The term patient is defined as anyone who has personal lived experience of a health issue, as well as their informal caregivers, including family and friends. Principal applicant must be self-directed and autonomous, must be able to hold peer-reviewed funds and publish research results, and has to be affiliated with the following institutions: University of Saskatchewan, University of Regina, Saskatchewan Polytechnic, Saskatchewan Health Authority, St. Thomas More at U of S, or Parkland College. They must be able to supervise staff and trainees, reside and work in Saskatchewan during the duration of the grant, and cannot be a current recipient of Sprout Grant or Leadership Grant, formerly known as Leader Award, as a principal applicant. They can be co-applicants on those grants, but they just can't be principal applicants. For co-principal applicant, they have to co-lead. They can be part of any role, does not need to be affiliated with the institution. They have to be based in Saskatchewan for the funding period and cannot be a trainee. Now, the co-applicant can also be any role. They might be outside from the province as well, but it has to be once the minimum team member eligibility requirements are met for the application. They can be trainees or research associates as long as they're not compensated from the grant funds. So now let's talk a little bit about the application process itself. So as I mentioned, before you begin, you need to fill out eligibility check. And the purpose of the eligibility check is to identify relevance to the purpose and objectives of the grant, to look for team eligibility, so whether you meet the minimum requirements. To facilitate the creation of review committees, you will be asked to provide potential reviewers as well as those reviewers that you would like for us to contact. I want to remind you that the reviewers have to be outside of the province. Also, the purpose of eligibility is to inform partners of interest and to formalize the process. Eligibility is reviewed internally by the SHRF program manager, in this case will be me. It's a rolling intake and approval process, and multiple revisions can be submitted until October 2nd. We do encourage early submission because it allows you to then make multiple revisions if necessary, and it gives you more time if your eligibility has passed. Through the review process, it gives you more time to work on your actual application. So we always say don't wait till October 2nd to submit your eligibility check. Review process, we made some changes from last year. It's still evaluated in a competitive peer review process like we always do at SHRF. It will be evaluated by 2 separate review committees. We'll have a patient-led committee from Saskatchewan, as well as multidisciplinary committee from outside of the province. And the final score is now based on 50-50, so we'll have scientific and impact at the value of 50%, as well as patient-orientedness at the value of 50%. Applicants will receive written comments from 2 lead reviewers on each of the committees. And funding recommendations will be based on a minimum acceptable score of patient-oriented review. So the applications must meet criteria definition in column 2 of the patient-oriented research level of engagement tool, also known as PORLET, as well as rate at 3.5 or higher on SHRF's 5-point scientific merit and impact scale. And you can find more details about that in the application package. The patient-oriented review criteria is to evaluate the degree to which a given project meets patient-oriented research criteria. It's based on the PORLET, and its PORLET is used as a guide for the criteria. There are 4 equally weighted criteria, so patients as partners, patients identified priority, patient outcomes important to patients, as well as integration of knowledge into practice. So the patient identified priority, is the explanation provided on how the PFAs have helped or will help identify the proposed research topic or questions that are priority to them. Outcomes important to patients will look into explanation of how PFAs develop the research outcomes in partnership with the research team, as well as explanation how the knowledge generated, knowledge generated through the proposed research will be used to improve outcomes important to patients. Integration of knowledge into practice evaluates the knowledge gained from the proposed project and how it could be used to improve healthcare systems and practices. Is there a target audience for the knowledge obtained? It will evaluate plans of knowledge integration and end-of-grant knowledge translation, as well as looks if the PFAs and end users have a role in the creation and implementation of knowledge. Now, patients and partners it's an over-encompassing criteria, and we'll look at the total involvement of patients in the project. We always strive for the patients to be equal partners in the project. And I will pass on to Kate so I can have some water, and she'll talk to us about the rooted committee.
All right, once again, we are including the rooted committee with the Sprout grant. This is where a representative from SHRF and SCPOR will meet with the Sprout grant recipients and possibly their team members if available. Meetings will occur on a biannual basis. The goal of the Rooted Committee is to discuss the success and the challenges of the research project, and as Alessia said before, discuss how SCPOR and SHRF can support the research team. I should also highlight that the Rooted Committee meetings do not replace the written progress reports. Back to you, Alessia.
I just realized we skipped a slide.
Oh.
We'll go back. Review criteria based on scientific merit and potential impact. So there are 3 criteria. Idea is worth 25%, approach is 50%, and expertise, experience, and resources is 25%. So idea looks at project goals, objectives, and target audiences, appropriate background information, whether research addresses patient-identified priorities, is the research original, unique, and creative, and if the position of the team for success is the team position for success to obtaining further funding. Approach focuses on study design and analysis being feasible and appropriate, our potential challenges and mitigation strategies identified, involvement of patients as partners throughout the project lifecycle, as well as KT activities. And lastly, expertise, experience, and resources looks at team members bringing complementary and interdisciplinary knowledge, experience, and expertise to benefit the research questions, experience and track record of the team members, is the research environment suitable, and is the budget appropriate? So with that, we'll now talk about what we've learned from last year and give you hopefully helpful tips for the good application. So put yourself in a reviewer seat, and this is a little bit tricky situation because you have to put yourselves in a peer reviewer seat as well as a patient reviewer seat. So you want to grab their interest. Answer the so what question right away. Make your case. It must be based on the patient identified priorities and needs. Keep in mind, SPROUT is the patient-oriented research grant, so patients have to be the center. Write clearly. Say what you mean in words that most people can understand. Patient-oriented sections should be written in a layman's language. PFAs don't necessarily have the scientific knowledge of the subject, so refrain from using terms and acronyms that most people won't know what they are. Provide detail, provide sufficient information about your project so that reviewers can assess your design and methods. Patient reviewers will only have access to the patient-oriented section. Therefore, please provide sufficient amount of information in your answers. We ran into that problem a little bit last year where most of the information was available in the actual proposal, but patient reviewers don't have access to proposals, so they can't see that information. They only see the answers you have provided in the patient-oriented section, so that's what they paste their review on. Don't forget to address potential bumps in the road. We all know research doesn't always go according to plan, so show that you have thought this through and have mitigation plans. Make it easy for them, so follow instructions, use headings, follow the format rules that we have laid out, and check your math. Don't distract the reviewer with numbers that don't add up, including the budgets. With that, I think that's all we have for our short presentation, and now we open the floor to any questions. So we have a question about the budget. The question is, do we have to state whether a specific amount of money is coming from shift dollars versus skipper dollars, or just lumped 180,000 together? Yeah, just put everything together once the decisions have been made, and if you're successful, there's specific things that are paid out from skipper versus SHRF, but that's done by research services, so you don't need to worry about it. For the purpose of the application, just put all of the budget together. We have another question. When can application process be started? You can really fill out eligibility as soon as we're done this webinar, or even right now. Eligibility takes a few days to be approved, and if any revisions need to be made, they will be sent back to you saying that you need to make revisions. But once you pass eligibility, you have all the time to work on your application.
Hi, everyone. This is Kate. We have a question in regards to being able to pay honoraria or a stipend to, this specific question is asking about Indigenous communities, and the answer is yes, of course, you can provide honoraria for individuals participating and contributing to your research. SCPOR does have some policies and regulations around that, and I encourage you to look in the Sprout application package. You're also welcome to contact our Indigenous Research and Engagement Expertise platform, as they have expertise of engagement in this area. Thank you.
Do we have any more questions? If you don't have any questions right now and you can think of something later on or as you're reading the application package, please feel free to contact either me or Kate. Here are our contact information, or we also have Tanya, who's our RMS guru, and she can help you out either through the phone or over email. We're always here, and hopefully we can answer all your questions. If we don't know the answers right away, we'll definitely get back to you with the answers. So if there's not any more questions, we would like to thank everyone for joining us today. And like I said, if you have any more questions later on, feel free to shoot an email or call. Thank you, Kate, for coming over and speaking to us on behalf of SCPOR. Yeah, and if you have anything else you want to reach out, feel free to do so. Otherwise, have a great day. Bye-bye.